All right, to this story now. President Cyril Ramaphosa tomorrow expected to sign the controversial National Health Insurance Bill into law. The draft legislation, which aims to create universal health care, has been over 5 years in the making. Critics saying the plan is unaffordable and will collapse the private sector. Ziniko Mhlaba has this report.
For many South Africans, one of the stains on the South Africa's 30 years of democracy has been the public healthcare system. Communities in rural areas have been subjected to traveling long distances to access basic health services. In the wake of unrelenting pleas for better services from communities, academics and activists, South African lawmakers had to act. The idea of quality healthcare for all, irrespective of social status, was born in 2011.
The national health insurance is intended to create one national health system for the country instead of the many parallel structures we have. And in so doing, we would like to achieve universal health coverage, which is a United Nations program that we are part of and that we are monitored by the WHO like many other countries. And what we aim to do is to achieve a situation where we get healthcare for everybody, irrespective of who you are, when you need it, where you need it.
Almost 14 years later, the scheme is yet to materialize. One health expert says quality healthcare is not a new idea.
What we have now is a political ploy where you bring up NHI, and in its preamble it says, you know, as though it's a new revelation that we must have equal access for healthcare. We knew that. That's what we were doing in the past.
But we didn't have that.
No, but that's where we were going. Now NHI says that's what we need to do. And so we don't understand that. It's not an innovation. It's fundamental.
The Treatment Action Campaign adds that South Africans, especially in rural areas, must manage their hopes and expectations.
On the 15th, the president will be signing the NHI, and many people believe that on the 16th of May, we will be able to access, or the NHI will be implemented in all the clinics. It is not like that. There is an office which is called Office of the Health Standards Compliance, which is established according to Section 79 of National Health Act. Okay. That office is the one that is going to inspect and certify health establishments which will be ready to be beneficiaries on the NHI fund.
The Progressive Health Forum says the signing of the bill might result in a messy situation in light of all the challenges in the public health system.
The most important thing for me is that if up to 90% of the population depends on the public health service, this bill will throw it under the bus. And it's already on its knees. Well, it's pretty clear from what you're saying that this is a non-starter. The country should be telling the president, don't sign that bill, send it back.
Outside legislature corridors, new political parties are also having a go at the NHI Bill.
What South Africans must not be naive about is what this NHI is supposedly going to solve. What it is not going to solve is a lack of an adequate health facility in my community in Mqanduli, with Zitulele Hospital being 45 kilometers in the opposite direction on a gravel road, and it takes you 2 hours to get there. And then once you get there, you get referred to Nelson Mandela Academic Hospital, 150 kilometers in the other direction, and you die on the way. And you know what? In between that, zero public health facilities.
The official opposition party has sent a serious warning to the president.
The Democratic Alliance will, upon its signing into law by Cyril Ramaphosa, challenge the ANC's NHI all the way to the Constitutional Court. Our legal team was briefed months ago already and will file our legal challenge against this devastating legislation. After all is said and done, it is only President Cyril Ramaphosa who has the power to reject or sign into law the much talked about bill. For Newzroom Afrika on Channel 405, I'm Ziniko Mhlaba in Johannesburg.